My name is Abrar Raza Sayeed. I'm one of the invasive general cardiologists at Goshen Heart and Vascular Center. I'm originally from India. So within the Goshen Health System, we have a very strong cardiovascular services line. We have our outpatient setting, which is referred to as Goshen Heart and Vascular Center. And then we also provide services within the hospital for our inpatients. Our service line also entails providing services to our patients in the form of their procedural needs. So we do have cath labs within the hospital. We also have an electrophysiology lab. We have a hybrid lab wherein we do some procedures which might need a surgical intervention along with the minimally invasive nature of interventional cardiology. And then we have surgical procedures like cardiac catheterization, implanting pacemakers, doing transesophageal echocardiogram to have a better look at the valve pathology that the patients may have. We also do a procedure which is called as a loop recorder. This is specifically useful in patients who have a stroke and we don't know the etiology of the stroke. It helps us in evaluating their heart rhythm to make sure that they're not having any breakthrough AFibs. So for all the patients who are on Coumadin as a need for stroke prophylaxis, or if they have mechanical heart valve, DVT or PE, we have a very strong Coumadin clinic at Goshen Heart and Vascular Center. We do monitor the INRs for the patients, make the dose adjustments as need be. Similarly, we have device clinic. This is for all the patients who have pacemakers or defibrillators implanted or loop recorder implanted. If one of your patients has pacemaker or defibrillator, they need to have a follow-up with an EP or with the cardiology here. Another important aspect of our clinic is we have a strong cardiac rehab program. I would encourage all our providers to consider cardiac rehab as a service for the patients who have congestive heart failure, who have coronary artery disease and recently had a PCI, or anyone who gets open heart bypass surgery, because cardiac rehab will be helpful not only for improving the quality of life for the patients, but it also helps the health system by reducing the readmission rates. Goshen is very unique from other practices because of the collaborative nature of care that we provide to our patients. We meet once a week with our vascular surgeons and interventional radiologists in a formal meeting, and then we discuss our patients like how best they would be served. This is one of the very few places that has this collaboration in practice, not just in theory, but in practice. And we work what is best for the patient, not what a surgical specialty or an interventional specialty or a interventional radiology specialty would like to do. Primary care referring providers, they don't have to make that decision like where the patient would serve best by being referred to. Once we make a decision with which specialty the patient will be best served for, we will take care of making the referral and setting up the patient with the required service. The nurse practitioners, they work in collaboration with the physicians at Goshen Heart and Vascular Center, wherein we sit in the same room, we have constant discussions every time there is an issue. They are really good at what they do, and I feel confident in their services. There is also satisfaction that I get when I see like we can make a difference on the long-term basis of our patients, wherein we are making interventions to prevent a heart attack down the line or prevent stroke down the line.